Hello. In Module 3, we're going to be discussing developing a comprehensive plan of care. The plan of care should be created concurrently with the comprehensive assessment and the CANS for children and youth. The plan of care is an active tool to guide day-to-day care management work. It should be inclusive of the member's needs and goals, including health-related goals, with the appropriate strategies to address their needs and promote health and safety. It's important to remember that the plan of care must be created within 60 calendar days of a member's enrollment. If the initial plan of care cannot be created within this time frame, the care manager must document in the chart as to why and identify a date for completion. It's also important to note that if you go into your third month of enrollment and the plan of care has not been created, the health home care manager will not be able to bill for services, for core services delivered to the member. Specifically for Children's Health Home, it is required that a team meeting be conducted every 6 months, and initially, the meeting should coincide with the development of the plan of care and the completion of the CANS. The entire identified care team should be invited to the meeting to be able to provide input on the plan of care. The authorized medical consenter and health home care manager are required to be present at the meeting. And if age appropriate, the child and youth should be invited to the meeting as well. In order to document a care team meeting, it should be done in contact notes. Primary reason for contact should be selected as other. This will allow you to free type interdisciplinary team meeting right in the reason for contact. This will allow you to clearly document that a care team meeting has occurred. The example note format for a team meeting, there is no right or wrong team meeting format. This is the recommended format for hosting a team meeting. You note that you're having a team meeting, the date, the time. Then you want to be clear on who you invited to the team meeting. Everyone listed here is recommended to be invited if they are involved with the child or youth. So that would be the care manager, the parent or guardian, medical consenter, the child, anyone from the school that you have been working with, any providers, any specialists, the primary care physician, a counselor, whether at the school or in the community, the med prescriber working with the youth, if there is one, any natural supports such as neighbors, grandparents. If the member is enrolled in HCBS, then you want to invite those providers to the care team meeting. And if they are in the custody of the county, you would like to invite the caseworker. So you want to make sure you note who you invited, and then you want to note who actually attended the team meeting. Then you would carry on with your note of the team meeting, such as this team meeting was conducted to review the 6-month plan of care. Then you would write what was discussed at the meeting. It's important to remember that care team meetings should be documented in the chart separate from other notes. This way it's very clear that a care team meeting has occurred. So if someone were to be auditing the chart, you would note specifically that a care team meeting has occurred and it wasn't included in another contact note or a care manager note. For the plan of care, it should involve the health home participant and or their legal guardian or representative. It should include family members, community and natural supports, and the member's identified care team. It should also document participation by all providers. It should list the outreach and engagement activities that will support engaging members in their care and promote continuity of care. And it should also identify appropriate referrals to community-based resources and ensure the engagement with these resources. This can be done through the care coordination tab for referrals. And then you would also include any referrals and resources that are being provided to the member through interventions and objectives. A comprehensive plan of care incorporates goals and objectives that support the member's desire to address their qualifying diagnosis for Health Home. Each member is enrolled in Health Home under a single qualifying condition or 2 or more chronic conditions. It's very important to remember that whatever makes the individual eligible for Health Home, such as SMI, SUD, or chronic conditions, that those qualifying diagnoses are addressed in the plan of care. The other thing to incorporate would also be safety and risk factors. These safety and risk factors are identified in your comprehensive assessment. For children's, they're identified in your CANS assessment. That's where you would note these, and then you'd want to incorporate them into the plan of care, because safety and risk factors are something that we want to mitigate and work on. You also want to know your strengths and barriers and preferences. This will be at the top of your plan of care. For children and youth, you would pull these straight from the CANS assessment. For adults, you can gather them through conversation or pull from your comprehensive assessment. Your plan of care should be written in language understandable to the member. This should be in their own words. They should be able to pick up the plan of care, read it, understand it. They will have to sign it, so they should be signing something that they can read in their own words. The plan of care should also focus on the total health of the member. We will be focusing on what makes that member eligible for Health Home, but we'll also be focusing on routine health care, such as annual primary care visits, dental visits every 6 months, social determinants of health. We want to look at the whole person, not just what makes them eligible for Health Home. You also want to incorporate supports, both paid and unpaid, that are needed to achieve the member's desired outcomes. This is a screenshot of the plan of care. As you can see on the top left-hand corner, or the top left-hand side, you'll see the goal statement. This should be verbatim what the member would like to work on. This should be in their own words. Again, you'll see the strengths and barriers. These are what you will pull either from the member's self-report, from the CANS, from the comprehensive assessment. On the right-hand side, you will see the different categories where your problems will be associated with. So it could be adherence, behavioral health, physical health, social health, and care coordination. This is where your problems will link to your plan of care and where you will input your objectives and interventions. And specifically to children and youth enrolled in Health Home, there are 2 other required assessments to be completed. That would be the Safety and Crisis Plan and the Emergency Plan. These 2 assessments can be found under the Assessments tab, and they need to be completed within the first 60 days of Health Home enrollment, and then at least every 6 months after that, typically coinciding with the a plan of care amendment. These 2 assessments will also have to be signed by the medical consenter and the member if age appropriate. If you have a member who experiences a crisis, ER visit, inpatient stay, the care manager must review the current plan with the family and the member. If the care manager and the family decide that the safety and crisis plan should be updated, that should be reflected in the member's chart with an updated safety and crisis plan assessment. If you review the plan with the family and the member, and they determine that the plan is still relevant and applicable, you should note in the chart under a contact note that some type of crisis, ER visit, inpatient stay occurred, and that you reviewed the safety and crisis plan with the family and the member, and they believe that it is still applicable and relevant, and no modifications need to be made at this time.